Come in.
Good morning, your student nurse today. With all this hand sanitizer and some gloves. Can you tell me your full name?
Matthew Michael Brown.
And your date of birth?
11/16/2000.
Alright, can I see your bracelet, please? Alright, I'll make sure that his full name, date of birth, medical record number match the bracelet and what I have in my chart. Alright, Matthew, do you have any allergies?
I do not.
Any medications?
Nope.
Any food?
None.
Any latex?
Nope.
Or tape?
Nope.
Or any environmental
Nothing.
allergies? Nope.
Nope.
Okay, I would make sure that his allergies match what I have in my chart. Alright, I'm going to go through your vital signs with you. Your blood pressure is 120/78, your heart rate is 72, your respiration rate is 18, your oxygen saturation is 99%, and your temperature is 98.7 degrees, which are all normally good. Alright, do you have any pain today, Matthew?
I have a little pain in my left knee.
Okay, and when did this start going on?
About 3 days ago.
Okay, and would you say it's constant or does it come go in and out?
It goes in and out.
Okay, and where exactly at in your knee?
It's right underneath my kneecap.
Okay, and is there anything that makes it better?
Not really.
Anything that makes it worse?
Putting weight on it.
Okay, and how would you describe your pain?
It's more of a sharp pain.
Sharp pain, okay. And have you done anything to treat it at all?
I have not.
Okay, and on a scale from 0 to 10, 0 being no pain and 10 being the worst pain ever, how would you rate your pain?
6.
6, okay. So the patient is alert and oriented, or alert, he's sitting up answering my questions, he's symmetrical. He told me his name, do you know where you are?
I'm in the hospital.
And do you know what day it is?
It is the 2nd of October.
Okay. So the patient is oriented to person, place, and time, which is good. I'm going to go ahead and check all your equipment. So you have a nasal cannula, so I'm going to check behind your ears, get any skin breakdown. No. And your nose? No. Okay. Does it feel okay?
Yes.
Yeah. Okay. And I will check for kinks in the tubing, and I will check to make sure that it's hooked up to the wall, and I will check to make sure that the flow rate matches what the provider ordered. I'm also going to check your IV. Is there any tenderness at all?
No.
No. Okay. So there's no redness, no swelling, no tenderness, which is good. I would check to make sure that there's no kinks in the tubing. Check to make sure that there's no breakdown around the injection site, and I would make sure it's hooked up to the IV bag, and that the drug and the route of administration were correct, so it would be in the correct spot. I don't see a urinary catheter, but if I did, I would assess that accordingly. Alright, I'm going to go ahead and look at your head now. So there's no lesions anywhere. The hair is even and clean, which is good, equally distributed. The temperature is normal, color is consistent throughout and normal for ethnicity. Capillary refills within 3 seconds. And just checking for any fitting edema. There's no edema, which is good. Yeah, I'm going to pinch your skin real quick. Okay, so skin turgor is normal and elastic. There's no lesions, but if there was, I would address those accordingly. Alright, I'm going to look at your ears again. Okay, like I said, there's no breakdown, there's no drainage or any piercings, no infections, it looks good. Alright. And I can go like this again and just look at the wall. Okay, so pupils are equal, round, and reactive to light. Can you go ahead and watch my pen for me? Okay, so as pupils converge and they're accommodating, I'm going to go ahead and look on your eyelids real quick. Okay, so the sclera is clear and the conjunctiva pink and moist, which is good. Can you go ahead and look up for me? Okay, so the nose looks good. Mucosa is moist, there's no drainage, and if there was, I would note color consistency in your mouth. There's no lesions either. Can you go ahead and open your mouth for me? Okay, so we don't have any injuries, there's no lesions, and the mucosa is pink and moist, which is good. Alright, can you go ahead and smile for me? Okay, so the patient's face is symmetrical and has full muscle use, so you can go ahead and stop. Alright, so the patient is alert, sitting up, doesn't appear to be in any distress or having any trouble breathing. But are you breathing okay today with you?
I'm breathing great.
Okay, can you go ahead and stand up and turn around for me? And then go ahead and check your lungs. And usually, the patient would just sit up in bed and I would listen to the lungs underneath the gown, but for the purposes of this video, Matthew's going to keep his clothes on. Alright, when you hear my when you feel my stethoscope hit your skin, you're just going to take a deep breath for me, okay? Okay, thank you. There are no adventitious sounds, his lungs sound clear and normal. If he had an incentive spirometer, I would teach him how to use it and have him demonstrate back to me how to use it so I know that he indeed knows how to use it correctly. Alright, I'm going to go ahead and feel your pulses now. Okay, so all his pulses are +2, the pulse rate is +2, there's no thrills noted, everything seems normal. Okay, and usually I would palpate his point of maximum impulse, which is the 5th intercostal space mid-clavicular line, but for the purpose of this video, I will not be doing that. Alright, I'm going to go ahead and listen to your pulse now. And I'm going to ask you to take a deep breath and hold it for me, okay? Okay, deep breath. Hold. Okay. Deep breath. Hold it. Okay. So I can hear any worries, which is good. And now I'm going to listen to your heart. I'm going to first go to the aortic, which is the second intercostal space, right sternal border, and then the pulmonic, which is the second intercostal space, left sternal border, and move down to Erb's point, which is the third intercostal space, left sternal border, and then down to the tricuspid, which is the fourth intercostal space, left sternal border. And then usually I would also take the mitral, which is the fifth intercostal space, mid-clavicular line, but for this video I won't be doing that. You can just go ahead and breathe normally. Okay, I'm just going to go back up. So the rate and rhythm of heartbeat sounds normal. S1 and S2 sounds are present, but S3 and S4 sounds are not present, which is good. So, do you have any numbness, swelling, or tingling in any of your extremities, your arms, legs, toes? Okay. Can you go ahead and just squeeze, okay? And then pull me towards you. Okay, and then touch your leg. Okay. And then go ahead and push down on my hands. And then pull up. Okay, so his strength is 5 out of 5. Range of motion, complete range of motion against gravity and resistance. All right. Have you had any nausea or vomiting? Any diarrhea? No? And do you have any dietary restrictions? And when was your last bowel movement?
2 hours ago.
And was it normal?
It was very normal.
Okay, sounds good. All right. If you go ahead and sit up straight for me, I'm going to go ahead and listen to your bowel sounds. The diaphragm. Just lean back just to stay straight. And usually I would do this on the patient in a supine position in the bed so he could be a little more spread out. But the bowel sounds are present in all 4 quadrants. If they weren't, if I didn't hear anything, I would listen to each quadrant for 5 minutes to make sure that he had some bowel sounds. So I'm going to go ahead and listen to your aortic now. Go ahead and move back a little bit. And usually this would all be done on the skin, but like I said, I'm just going to keep the shirt on for this video. Okay, so no release my notice. That's good. All right, go ahead and sit back again. Go ahead and feel. Any tension here?
No.
Okay.
No.
Here? Fine.
No.
So, with our appendix, which is good, there's no guarding, no masses. Belly's firm, but he just ate, so that's pretty normal. Okay, and have you been urinating more frequently than normal?
I have not.
Okay, and when was the last time you urinated?
10 minutes ago.
Okay, was it normal?
It was normal.
Okay, and about how many times in a day do you normally urinate?
3 to 5.
2 to 5, okay. So, usually I would just monitor his input and output, and I would measure and assess the urine for color consistency and amount, and clarity as well. Alright, so you have your call light. Is there anything else I can do for you? Okay, and then usually I would put the bed back down to a normal height for him and get him all situated how he wants to be laying and stuff like that. Alright, well thank you, Matthew.
Thank you.
Okay, wash my hands and then